So recently, you were told by your doctor that you have gastroesophageal reflux disease. Gerd is a disease characterized by the backflow of gastroduodenal contents into the esophagus. Gastroduodenal contents refer to substances from your stomach and the first part of your small intestine, which travel to the esophagus to cause a variety of signs and symptoms. Symptoms are any effects of the disease that are experienced by you as the patient and include heartburn or chest pain, recurrent dry cough, vomiting, epigastric pain, as well as respiratory problems. Signs are effects of the disease detected by a healthcare professional and often may include esophageal mucosal complications such as esophagitis or Barrett's esophagus, as well as laryngitis, dental erosions, and recurrent otitis media. So what is the cause behind the onset of these signs and symptoms? In fact, the causes of this disease are often complicated and multifactorial and can be attributed to problems with the anti-reflex barriers, such as the lower esophageal sphincter, which is a ring of smooth muscle which inhibits swallowed food from traveling backwards, as well as the crural diaphragmatic sphincter, which provides an external squeeze to the LES. The LES normally creates a high-pressure zone between the stomach and the esophagus. However, conditions such as abnormal gastric emptying, as well as hiatal hernias, which limits the ability of the crural diaphragmatic sphincter from preventing reflux, causes an abnormal increase in intragastric pressure. Furthermore, the stomach contains pits which house different types of cells, including parietal cells, which are responsible for producing hydrochloric acid, and contain two types of pumps, including a proton pump, which pumps out hydrogen ions into the lumen, and another pump which pumps out chlorine, thus forming hydrochloric acid. Therefore, LES is unable to prevent the gastroduodenal contents from entering the esophagus and thus leads to the entry of acidic substances from the stomach, such as hydrochloric acid, resulting in increased mucosal damage, thus resulting in signs such as esophagitis and Barrett's esophagus. Management involves making lifestyle changes such as losing weight, wearing loose-fitting clothing so that the reflux is not pushed from the stomach into the esophagus, staying upright after meals for approximately 3 hours, as well as refraining from smoking. Treatment options may involve the administration of proton pump inhibitors, which work to change the pH of the refluxate and thus decrease the acidic content contained within the stomach. Antacids are also administered, which decrease acidic content by neutralizing the acids produced. Finally, surgical intervention called Nissen fundoplication can also be utilized to treat GERD, and involves utilizing the fundus of the stomach to increase LES pressure to stop food from entering the esophagus, thus addressing the problems of low esophageal tone and problems with the crural diaphragmatic sphincter.